ਜਿਹਨੂੰ ਕਹਿੰਦੇ ਪੰਜਾਬੀ ਸਾਹ ਚੜ ਜਾਂਦਾ ਹੈ, ਉਹ ਹੋਵੇ। ਰੂਟੀਨ ਐਕਟੀਵਿਟੀ 'ਚ ਹੀ ਤੁਹਾਨੂੰ ਸਾਹ ਚੜ੍ਹਨਾ ਸ਼ੁਰੂ ਹੋ ਜਾਏ, ਜਾਂ ਤੁਸੀਂ ਇੱਕ ਦੋ ਜਾਂ ਦੋ ਮੰਜ਼ਿਲਾਂ ਚੜ੍ਹਦੇ ਹੋ ਉਹ 'ਚ ਤੁਹਾਨੂੰ ਸਾਹ ਚੜ੍ਹਨਾ ਸ਼ੁਰੂ ਹੋ ਜਾਏ, ਜਾਂ ਤੁਹਾਡੀ ਛਾਤੀ 'ਚ ਜਾਂ ਲੋਅਰ ਪਾਰਟ ਆਫ ਦਾ ਜੌ 'ਚ ਜਾਂ ਤੁਹਾਡੇ ਦੋਨੇ ਬਾਹਾਂ 'ਚ ਦਰਦ ਹੋਣਾ ਸ਼ੁਰੂ ਹੋ ਜਾਏ। ਤੇ ਇਹ ਇੱਕ ਦੋ ਖਿਆਲਾਂ ਤੋਂ ਪਤਾ ਲੱਗਦਾ ਹੈ ਕਿ ਆਪਾਂ ਨੂੰ ਹਾਰਟ ਡਿਜ਼ੀਜ਼ ਹੈਗੀ ਹੈ। ਇੰਡੀਆ ਅਬਾਊਟ 30% of the population is suffering from blood pressure or a hypertension. Recently, we have seen that the heart disease is more common in the younger age, only because that they are eating too much of the junk food, not doing the regular exercises. They are about taking a lot of smoke and different kinds of drugs, which definitely harms one's body, one's heart. And doing the cardiac care for the last so many years, we have echoes, TMTs, we have angiographies, angioplasty, minimum invasive cardiac surgeries, open heart surgeries, valve replacement, and various cardiac devices are done over here. If you have a disease like hyperthyroidism or diabetes or a cholesterol is high, take the regular drugs, walk properly, have a regular exercises, take medicine regular time, so that's a way you can prevent your heart diseases, and you can prevent by yourself also.
Hi, you're watching The Savera. This is Amarpal Singh before you. Heart diseases, they are not only confined to elderly generation nowadays. Nowadays, the younger generation, they are also diagnosed with the serious cardiac diseases. So to understand what kind of factors they are affecting the heart health, we are having with us Dr. Kulwant Singh, who is the director of Deepak Heart Institute's Deepak Hospital, Ludhiana. So sir, first of all, welcome to The Savera.
Okay, thank you for calling me.
Sir, how you see what kind of factors they are affecting the heart health as we are seeing the increase in the number of cardiac cases among the younger generation?
You see, the heart disease is increasing day by day. In India as well in the Western countries, heart diseases are very common. In India, about 30% of the population is suffering from blood pressure or a hypertension.
Right.
Once you diagnose to have a hypertension, a majority of the patient doesn't take treatment.
Right.
About 40 or 50% of the patient does not take the treatment. Only few percent of the patient, like 10, 25% or 20%, takes the treatment.
Right.
Hypertension, you see, it's a silent killer. It kills the patient not in months, it kills the patient after years. It has a lot of complications, like it has a heart attack, it affects on the eye, it affects on the kidney, it affects on your peripheral vessels. So one hypertension is diagnosed, one should take care of his blood pressure, take the drugs regularly, meticulously, and control the blood pressure. Now you see, at this time, younger generations are having heart disease. Why the younger generations are having heart disease? You see, they are very stressful conditions and living. They are living in a very stressful conditions, and they are very obese, and there is a dietary habit is bad. They are eating junk foods, not doing the regular exercise. And if you don't do the regular exercise, don't eat properly, don't take care of your health, then heart diseases is bound to occur. That is why the younger generation is having heart disease like heart attack, blood pressure, which is increasing day by day.
Right. Sir, how you see the lifestyle changes nowadays, that whether it is like you mentioned that the exercise it plays a role, smoking habits, as well as the stress nowadays among the people, how this is contributing in this cardiac cases?
For the cardiac care, recently we have seen that the heart disease is more common in the younger age, only because that they are eating too much of the junk food, not doing the regular exercises. They are about taking a lot of smoke and different kinds of drugs, which definitely harms one's body, one's heart, and they are producing different kind of symptom, and there is incidence of sudden cardiac death in these kind of younger patients. So I'll advise younger generation to work hard, take care of your diet, take care of your health, don't be obese, don't put self in a stressful conditions, make yoga, make meditation, so that you can have a good and comfortable life.
So, what are the early signs symptoms that one should not ignore?
So you see the sign and symptoms are very common. Anybody who's having breathlessness on exertion, just on slight exertion, if you have a ਜਿਹਨੂੰ ਕਹਿੰਦੇ ਪੰਜਾਬੀ ਸਾਹ ਚੜ ਜਾਂਦਾ ਹੈ, ਉਹ ਹੋਵੇ, ਰੂਟੀਨ ਐਕਟੀਵਿਟੀ 'ਚ ਹੀ ਤੁਹਾਨੂੰ ਸਾਹ ਚੜਨਾ ਸ਼ੁਰੂ ਹੋ ਜਾਏ, ਜਾਂ ਤੁਸੀਂ ਇੱਕ ਦੋ ਜਾਂ ਦੋ ਮੰਜ਼ਿਲਾਂ ਚੜ੍ਹਦੇ ਹੋ ਉਹ 'ਚ ਤੁਹਾਨੂੰ ਸਾਹ ਚੜਨਾ ਸ਼ੁਰੂ ਹੋ ਜਾਏ, ਜਾਂ ਤੁਹਾਡੀ ਛਾਤੀ 'ਚ ਜਾਂ ਲੋਅਰ ਪਾਰਟ ਆਫ ਦਾ ਜੌ 'ਚ ਜਾਂ ਤੁਹਾਡੇ ਦੋਨੇ ਬਾਹਾਂ 'ਚ ਦਰਦ ਹੋਣਾ ਸ਼ੁਰੂ ਹੋ ਜਾਏ, ਤੇ ਇਹ ਇੱਕ ਦੋ ਖਿਆਲਾਂ ਤੋਂ ਪਤਾ ਲੱਗਦਾ ਹੈ ਕਿ ਆਪਾਂ ਨੂੰ ਹਾਰਟ ਡਿਜ਼ੀਜ਼ ਹੈਗੀ ਹੈ। ਤੇ ਹਾਰਟ ਡਿਜ਼ੀਜ਼ ਜਦ ਇੱਕ ਵਾਰੀ ਹੋਵੇ ਫਿਰ ਤੁਹਾਨੂੰ ਆਪਣੇ ਡਾਕਟਰ ਕੋਲ ਜਾ ਕੇ ਆਪਣਾ ਪ੍ਰੋਪਰਲੀ ਉਹਨਾਂ ਨੂੰ ਐਕਸਪਲੇਨ ਕਰਨਾ ਚਾਹੀਦਾ ਹੈ। ਫਿਰ ਡਾਕਟਰ ਜਿਹੜਾ ਤੁਹਾਡਾ ਟੈਸਟ ਕਰਦੇ ਨੇ, ਬਲੱਡ ਟੈਸਟ ਕਰਦੇ ਨੇ, ECG ਕਰਦੇ ਨੇ ਔਰ TMT ਕਰਦੇ ਨੇ, ਐਕੋਕਾਰਡੀਓਗ੍ਰਾਫੀ ਕਰਦੇ ਆ, ਉਹਨਾਂ ਤੋਂ ਇਹ ਪਤਾ ਲੱਗ ਜਾਂਦਾ ਵੀ ਇਸ ਪੇਸ਼ੈਂਟ ਨੂੰ ਕਿੰਨੀ ਹਾਰਟ ਡਿਜ਼ੀਜ਼ ਹੈ।
Right. Doctor, Saab, now we oftenly hear that a person suffers silent heart attack. What is this silent heart attack?
Silent heart attack is a heart attack when there is no symptom and the patient almost suddenly dies or almost have a sudden cardiac disease, in which you see there is a plaque in the coronary artery disease. We have three vessels in the heart which supplies the blood to the heart, and once there is a narrowing of that arteries, that produce angina, that produce a coronary artery disease. We have seen that in the younger generation there is a plaque. All of a sudden the plaque ruptures, the blood flow to the concerned artery stops, and there is a clotting of that area, and which can lead to sudden arrhythmias and causes a death. That's the most important common cause in the younger generations. Right. But in the old age, symptoms are more, the coronary arteries are thickened, there are a lot of calcification. So in a younger generation, the plaque rupture is important and causes the death.
Right. So you mentioned about that one should do proper exercise. So what kind of physical activity is ideal for the younger generation, or we can say any person?
So the exercise is very important. We have to do 5 days a week and at least 30 to 40 minutes per day. You can have a walking. The best thing is you can do the jogging, swimming, cycling, and aerobic are the good exercise for the younger generations.
Right.
But you can have a regular walk for 4 to 5 days a week, and all depends upon your age and your general conditions. So definitely your walk, your exercise in swimming, cycling, jogging is helpful, and it causes the prevention from the heart disease as well as the diabetes as well as the obesity. So definitely one should have a good exercise.
Right. So if one have any cardiac diseases, so what kind of facilities are over here with you that will you treat the patients with utmost accuracy and precision?
So this is a cardiac center. It is a complete cardiac center with advanced technology. Here we have one of the best team available. We have few DMCs, professors of DMCs, CMCs, and we doing the cardiac care for the last so many years. We have echoes, TMTs, we have angiographies, angioplasty, minimum invasive cardiac surgeries, open heart surgeries, valve replacement, and various cardiac devices are done over here. It's a hospital which is doing the prevention also for the heart disease. We are educating our patient to have a preventive heart disease. So it's a hospital with affordable price to the people of Ludhiana as well as the surrounding area.
Right. Sir, at last, what message you want to convey to the residents regarding the lifestyle changes that they should adopt, whether it is regarding the exercise, as you mentioned, the dietary changes, or the regular checkups that one should do?
I advise everybody to take care of the heart, because heart is a thing which is very important for your well-being. So to take care of that, one should have a proper health or heart checkup, proper blood checkup, or they should be good dietary habits. Don't take too much of the junk food, take regular exercise, avoid obesity, and if you have a disease like hyperthyroidism or diabetes or cholesterol is high, take the regular drugs, walk properly, have a regular exercises, take medicine regular time. So that's a way you can prevent your heart diseases, and you can prevent by yourself also.
Thank you so much. So he is Dr. Kulwant Singh, who is director of the Deepak Heart Institute, Deepak Hospital, Ludhiana. So he has shared valuable insight into the increasing cases of the cardiac diseases and the way the lifestyle changes they are affecting your heart health. So stay healthy, take care of your heart, and stay tuned to Das Vera for more updates. Amarpal Singh with cameraman Sandeep Singh.